Welcome back to our series, New Year Healthy Choices. I'm Dr. Mandy Diamond, licensed clinical forensic psychologist and senior clinical advisor for SOBRsafe. Today, I am so honored as to who our guest is. He's been a very close and dear friend of mine for the last 13 and a half years. He has a ton of professional and personal experience with today's topic. So please welcome Jason Waller.
Hi, Mandy. Thank you so much for having me. It's
Uh,
great to see you.
Good. So tell the people that may be seeing these videos, if they don't know about you and some of your story, introduce yourself.
Well, before I do that, I think first and foremost is the history that we have. We've been friends since what, 2010? Does that sound about right?
Yeah, I
It's
think
about
so. Like
2010,
end
about
of 2009, beginning 2010, long time.
yeah, it's been 16 years, which is crazy. I actually was the best man in your guys' wedding, so there's a lot of history there. We worked together. We helped a lot of people back in the day at one of the treatment programs that we worked with, and you were the clinical director, and I was the liaison between the clinical team and the clientele, which was a really unique perspective. And I think that dives into your question initially around my background. I'm somebody that struggled with mental health and addiction for many years, all the way since I was a young kid at 12 or 13 years old. Struggled with OCD pretty bad to the point where I'd wash my hands until they'd bleed and I'd put neoprene gloves on. And I had a very supportive family, saw all the doctors you could think of, psychiatrist, therapist, was put on medication. It helped mitigate those symptoms, but I never dealt with the underlying issues. And ultimately, I found alcohol, and I said, "Who needs medication when you can find alcohol?" When I went down that road, and I ended up struggling pretty severely from an adolescent, young adult to my early 20s. I ended up landing in about 12 or 13 treatment centers from Florida to Hawaii, every state in between. I went through a very public battle with addiction. I was on television for many years, and it was not helpful or conducive to be on national television when you struggle with addiction. Also, it's funny, God has a sense of humor because my greatest deficits have become my greatest assets. Being a spokesperson for addiction was like the last thing I thought I was really going to do. But again, my greatest deficits have become my greatest assets. And I found a true sense of purpose and meaning in doing that. And I have a lot of lived experience. I've worked with a lot of amazing professionals, a lot of SAM certified doctors, a lot of researchers, a lot of psychologists, a lot of therapists. And so I've just been able to, through my own journey, gain a vast knowledge of addiction, not only from professionals, but from lived experience.
And you had a huge milestone two
Yeah.
days ago of hitting 6 years of sobriety. So, talk a little bit about that and what has been the mindset changes you've seen throughout your years of sobriety so far?
It's a great question. Well, thank you, first of all. 6 years. I mean, it's obviously a very proud moment for me, especially since I really entered into recovery July 23rd, 2010 is when I really dedicated my life to sobriety. But obviously, I wasn't able to maintain or sustain sobriety through that whole time. And so I learned a lot when I'd relapsed after several years of sobriety. Looking back, I always tell people that relapse is not a part of recovery, it's actually a lack thereof. And what's predictable is preventable. And I can see all the things that I started to do that was driving me away from my program that ultimately led me back to relapse. And so I back at it these last 6 years that I've had was a real opportunity to reflect on a lot of the stuff that I knew and the things that I did well, and obviously the things that I didn't do well. And I think one of the biggest pieces is self-care. It's like I told my wife when I first met her, I said the most important thing in my life is besides God is my recovery, because if I don't have that, I won't have anything else. And after what we went through, it was a perfect example of what we were able to witness and see, right? And so it was a lot of learning that came through that. But I think not only the self-care, but the honesty. The biggest thing that drew me back was finally being able to get willing and honest and be able to be coachable, to have a place where I was in a direction again. And over this last 6 years, though, I've really made it a priority to have consistency and structure in my life because it ultimately brings a sense of safety and having a program that I don't deviate from. So that's something that I've been building upon. And there's a lot of things that we can go into. Happy to discuss some of the things that I do on a daily basis. But having that in play has really helped me evolve in so many different ways in my life, mentally, emotionally, physically, spiritually. And I'd say the last year, even the last couple years, reflecting back, because a lot of people have asked me, what's been the biggest difference between 5 to 6? And it's the continuation of emotional growth and emotional maturity, which has been fantastic because for those of people that don't know out there, when you start drinking and using, especially at a young age, you basically, from a neurological perspective, you stop developing within your brain. And so there's some catch up still, even after having stints of sobriety that I still needed to grow in. But my relationship with the Lord got a lot deeper these last couple years. Also, being more intentional with my time has also been a big thing. Learning to say no more, the more sobriety time that I've gotten, and the more that I've worked on myself, the more that I've realized that there's always areas for improvement. So I also joined Al Anon, got a sponsor, and I'm working that program on top of my alcoholic program, and continuation in therapy is something that has been huge. I haven't deviated away from that. And this has been something that's been instrumental in my life and always an opportunity and a continuation for growth. And so it's been awesome. It was just really crazy to look back in the last 6 years and specifically the last four. Sobriety has given me the opportunity to make major changes in my life that I would never have been able to do. You knew back in the day, especially when I was actively using, I wasn't in a place to ever move outside of city limits, let alone out of the state. But here I am across the country and being able to be selfless and make decisions based on what's best for me, what's best for my family. And it's just been a really big growth part of my life. I mean, it's this sobriety has just been such a gift and such a blessing, but these last 6 years are pretty incredible. A lot of transformation has happened.
I'm very proud of you watching your transformation throughout the years. I think it's been just amazing to watch you grow. And I love your relationship that you've developed with the Lord. And you've always had that, but I've definitely seen that just elevate and the happiness that's come through sobriety for you and this whole journey. So, Jason, as we're looking back, going through the holidays, we know how challenging the holidays are for so many people. And now that we're into the new year, and for many people, they base their New Year's resolutions around health. And for a lot of people, that includes dry January or becoming sober curious or going in with full sobriety. So for you, I have two questions. One, did you ever make that a New Year's resolution for yourself, all the different times that you were trying to stop drinking? And if so, what were some of the struggles you had with that? And second question, with anyone that has made that decision to be sober in the new year and is so motivated right now, but are fearful that they may end up not being able to do it, what would you say to them?
Man, that's a loaded question. But first, when did dry January start? Does anybody know that?
I don't know. I know I started hearing about it probably 5, 6 years ago.
Okay,
Before
yeah.
that, I don't know if it was a big thing, but a lot of my patients about 5, 6 years ago is where I would start hearing, oh, I'm doing dry January. And I'm sitting there thinking, what does that mean? And then started hearing, oh, this is a thing. People just give up alcohol for January.
Yeah, no, we're on the same page. I just wanted to make sure this wasn't going around for the last 10, 15 years because I remember it being more of a new thing. And so yes, I can't remember super specifically. I mean, I always look at the start of a new week, a new month, a new year, obviously, as a big opportunity to make significant changes. And I'm sure I made commitments that I was going to stop drinking on the new year or day after at least. And clearly that wasn't the case, especially with my date that I have now of December 17th. But I think there's something that's motivating the beginning of something. And so I think people grasp onto that. I'm sure there's some research around how that really creates motivation behind people and just thinking of a new way, especially a start to a whole new year. It could be incredible. So, yes, I'm sure whether it was sobriety, there's a lot of things in my life that I look at the new year about how I'm going to approach it differently. For me this year, one of the things that I'm focusing on is saying no more. And so whether you're wanting to stop drinking, you're wanting to stop using drugs, whether it has to do with starting to exercise or look at how you're doing diet, I think it's a motivating factor for a lot of us. But that's for me looking at 2026 as a whole is saying no more. And again, that's learning what I've learned through boundaries. And so that's something that's really important to me. But for people that are out there that are specifically looking to stop drinking and looking for motivation or inspiration going into this new year, about stopping or looking at the relationship with alcohol, I'd pose one simple question to you because a lot of people look at like, am I an alcoholic or am I an addict is like it's a very negative connotation. And so what I would ask an individual to do is really to just sit with themselves and ask a question to themselves is this adding or is this subtracting from my life? And really to really grasp a hold of that and to really like, because you'll know that. That's how I interact
Absolutely.
with people that are from my side that are very clear that struggle with addiction. I'm like, it's not my job to tell you, but like, let me just ask you a question and really ponder that. And there's been never once where they're like, yes, this is adding to my life. And so I think grabbing hold of that and that really creates a form of acceptance around like, hey, there's a true issue here, and I maybe should really look at my relationship with this. And then I'll never forget too, with like one of my first sponsors that I had, he goes, look, man, let's get on track. Let's be at a place where you're willing to take guidance and direction. And if your life does not drastically change in the next year, I will happily take you to wherever you want to go, buy you whatever drug of your choice, alcohol that you want, and I will take you back to that spot. And by the grace of God, after having that year of sobriety, I mean, my life completely changed. And so I think it's really getting people into a spot of looking at where they're at but really getting honest with themselves because again, addiction is a disease of denial. And so I think it's so important to ask yourself that question, is this really adding or subtracting? And what is it really doing?
Mhm.
Because you and I both know drugs and alcohol are a part of the solution. That's not the core crux of the problem. You actively arrest the disease, you get somebody stabilized. You got to look at what's going on underneath. And so
Absolutely.
that would be my piece of advice, just as a simple thing to look at. It's not something that has to be overly complex and super crazy. It's like, dude, is this really helping me or is this really not?
Yeah. I mean, I've seen that. I know you have with all the people you've worked with, but I'll have so many patients that are so scared to give it up. And we know from all the science. And I mean, just recently there was a massive study done that now links alcohol to 7 different types of cancer and all these other pieces. And so when you look at it, there is not one study, one person that is going to really truly be able to say, alcohol has benefited my life in these ways. There's nothing good about it. It doesn't improve any aspect of the body.
Yeah.
But when you remove it, the things that happen are insane. Just clearer mindset, a more positive mood, you sleep better, less anxiety, less depression, less relationship issues. So
Yeah.
it is like there's this huge benefit that comes. And I think, I mean, I see it, and I know when a lot of the patients you and I used to work with, there was that misconception of, oh, if I take out alcohol, I'm never going to be able to have fun again. And instead, it's like, look at all that you gain by taking it out.
Well, look at how crazy addiction is, right? I mean, there's obviously more clinically appropriate terms of this, but for an alcoholic or an addict, they're willing to give up everything for one thing versus giving
Yeah,
up one thing to have everything. Like
exactly.
when
I
somebody hit me
love
between
that.
the eyes with that, I was like, it was a professor at Vanderbilt, and I was like, damn, bro, that was good. I'm like, it's
Like,
super
yeah,
simple.
yeah.
I mean, that, oh, I have goosebumps. You can't see through
Yeah.
my picture, but
And we've seen that. I mean, just in your own life, looking at that, I've known you for so long. I watched as you met your now beautiful wife and what that journey is. You're now a dad of 3, which I blows my mind. You were just the uncle to my twins and they were so big and now they're in college and all of a sudden you've got 3 little ones running around. But I think sobriety has given you all of that and just so much. And I know one of the things that you and I both have such a passion around Sober Safe and what it does for people, and especially the Sober Sure bracelet. So, what do you see with the people you work with? And I know you use it yourself. How can that be used as an accountability tool for those that have made the decision they want to be sober? They're into the new year, they're motivated, but they want more accountability and they may not have that full support, trusted support network. How could they use this device and what have you seen within your own life and those around you that have used it in building that accountability?
no, for sure. And I 100% will answer that, but I want to take it a step further. and talk about it from preventative first, because I think that's a spot where all of us could benefit from. Again, addiction is the leading cause of death in America for 50-year-old individuals and younger. There's 40 plus million that are in recovery. And if somebody doesn't drink or use by the age of 21, they have a 90% chance of never struggling with addiction, no matter what their pre-genetic disposition is. Why are we not doing a lot more from a preventative side? And so I know for my kids, they're right now, they're young, they're 8, 4, and 7 months. But you better believe, since the average age of first time use in the United States is 11 and a half years old, my kid's getting pretty close to where she's going to have a band on, because I do anything that I can possibly do to help her get to that 21-year-old, that mark. And again, as I'm already having conversations with her, which is actually really special about this birthday that I just had, because quick side story, she literally goes, Ashley had the house decorated and stuff, and I don't know why she didn't catch on before. She's been very intellectual and smart since a young age. She goes, "Whose birthday is it?" She's like, "It's your dad's." And she's like, "No, it's not." And that was the time where I was able to really break the silence around alcohol. I had the conversation around her and why it's important, how our family is pre-genetically disposed to it, and how it can actually be harmful to you. And we started that conversation, which I think was really powerful. And so again, those conversations are already happening because we're setting the stage for that to happen. Then there's other tools and things that I do with my daughter to incorporate a sense of safety, connectivity, and trust ultimately. And that's through questions I do at night with her. So we're normalizing the conversation, because it only becomes harder and uncomfortable if the conversations aren't being had. And so, again, from a preventative standpoint, there's a lot that we can do to mitigate people struggling with addiction. And so I think the band could be a very beneficial tool, especially for all the parents out there that have App 360, you want to track where your kids at, which is like a normal thing today. Why not add an extra element, especially to prevent drinking and driving, to prevent underage use? Get them on the band again. It's got the first ever 24, it monitors 24/7 for alcohol monitoring, right? I mean, then it's got the band removal. It's the first ever transdermal alcohol monitoring detection band. It monitors for alcohol 24/7. It's got GPS tracking. So again, like the App 360, and then it's got band removal notifications. And so from that perspective, there's, again, my daughter goes out when she's 11, 12, 13. She wants to go to the football game. She wants to hang out with her friends. Go for it. But you're going to wear the band. So I think that's one area that we can definitely capitalize in the beginning. And I think it's really important for people to understand like how instrumental that can be. And I mean, you could save a lot of heartache and a lot of trauma, especially if there's a history within your family, which there's millions and millions of people have it. So that's one thing. Then going into your question about how this can be beneficial for those that are newly sober, that are just coming out of treatment. I think there's again a two-pronged approach with this, especially for families who have high level of codependency. I worked with a lot of people who are very codependent in their loved one's addiction, right? And honestly, causing more harm than good, when on the outside it really looks like they're helping and being beneficial, but ultimately they're not. The mom and dad, brother, sister, they oftentimes step the lines of just being the sibling or the parent and thinking they're the doctor, thinking they're the psychiatrist, thinking that they're the clinician. And they need to really remove themselves. And so this tool is a way that they don't have to be over somebody's shoulder constantly, continue to be supportive, but to have a high level of accountability and establish trust with them, especially for parents that are out there that are paying for bills for people. I've seen this a lot where it's been a very big leveraging tool. It's like, hey, look, we love you, we care about you, we want to support you. And for us to continue to pay your car payment, your rent, for your cell phone bill, you're going to wear this band because we need to know that you're sober. And so it creates a very clear delineation for people that are needing support and they want to be supportive to their loved one, but also be able to remove themselves so they can continue to take care of themselves and remove them from the addiction, and I'll let the professionals work on that. So that's one area that I've seen that's been really helpful. And then for the new person in recovery, it's an added tool. I mean, look, at the end of the day, I have 10 different things that I do for my sobriety. And whether I have accountability calls with people, I have Bible study for me, I have therapy, I go to AA meetings, I go to the gym. There's a list of things that I have that are part of my toolkit that I incorporate within my recovery. And this is another way for people to have a high level of accountability. It's a great reminder, especially if you're in a triggering moment, just to understand there's a reason that I'm in this spot and there's a reason that I'm wanting to maintain sobriety. But also, it's a great out. I've seen people that have been put into peer pressure situations where they're struggling with early sobriety and trying to identify whether they want it or not at this time. When they're in that peer pressure situation, I can't drink. I'm being held accountable. It's just a way out. There's many ways that it can be incorporated into somebody's life. It's also, for me, I always just see it as fresh reminder of what I told myself when I had to go back into treatment again. This is the last day I ever want to feel like this again when I was going back into detox. And also having that there and remembering why you're doing what you're doing. So it can be used in so many different ways.
What I love about it, I treat a lot of professionals that have been board ordered. So medical doctors that have got caught drinking, showing up to work or whatever. I work with a lot of surgeons and attorneys, and at different times they'll get in trouble and then they have to be monitored for up to 7 years. And what I love about this device is no one knows what it is. It looks like a Fitbit or an Apple Watch versus in the past, my patients would have, I would set their time, they would have to blow in this device 4 times a day. And I had a surgeon one time say, I cannot do this in the midst of surgery. Be like, I have to scrub out. I need to go blow in my breathalyzer. And this device, you don't have to. It's there on the wrist. It's easy. So I think, too, for a lot of people that may not want to wear something out of like, oh, people are going to know what this is. This device just is so small, but yet establishes so much accountability. It doesn't stand out, and it also helps gain back trust for people as well.
For a lot of different areas, but talk about a much more humane way. Trust me, I had
Yes.
the breathalyzer back in the day. I remember being on a date and I'm like, hey, I'll be right back. I got to go breathalyze. This is so demoralizing. Like, okay, I'm already struggling with something that I have some shame that's associated with it. Let me now beat me down while I'm already beaten down. So
Yeah.
I think that's another area that's really important too. It's a very discreet way. It's more humane. And again, it's very discreet.
Yeah, absolutely. And it does monitor 24/7. So there's less of an
That's
opportunity.
well, let's talk about. I mean, there's so many
Yeah.
people, especially addicts and alcoholics, when they're in active addiction. In general, they're very intellectual,
Mhm.
smart individuals, but especially when they're active, I mean, I've seen so many people be breathalyzers. I mean,
Yeah.
so many people, and it's like, hey, okay, as opposed to testing 2 to 4 times a day through a breathalyzer, why not do it? We just have continuation and continuous monitoring. And
Yeah.
so that's another thing that comes into effect. And that's also what's helpful for people when they have the band on. It's monitoring 24/7. It helps alleviate that thought process, right? Because as somebody that had the breathalyzer and was trying to manipulate the system, it's like becomes a whole thought pattern and process. Like, how am I going to beat this? And so
Yeah.
knowing that there's concrete 24/7 monitoring, it changes the way you can think.
Yeah. And I love what you said before that it can be used as an out. And
Yes.
that word no, like if you're getting pressure and you're learning to say no, the bracelet can also be used as the out. Oh, sorry, no, I can't drink. I'm being monitored right now. So I love that you brought up that. One of the other things before we end, you talked about your routine, your non-negotiables for your recovery. And as we're starting this new year, 2026, which is crazy. What are some of your non-negotiables? Talk a little bit about your routine and how that all fits in with you maintaining sobriety.
Yep. So sobriety for me, it's a whole new way of life, right? And so in the morning, from prayer, meditation, reading from some scripture, and then from there I do a gratitude list. I've been doing this for years. It's 3 things I'm grateful for, not only what but why, and I share that with about 12 other men, which is awesome. It's a great way to stay connected. You're starting the day off in a positive mindset, but more importantly, you're also having fellowship and camaraderie with a bunch of other guys. From there, something that I've been incorporating every morning now more so, it used to be 3 times a week, but now it's been 5 days a week, is the gym. So again, as your brain produces more potent chemicals than heroin, you just got to let it work. And so when you're exercising, it's one of the most powerful ways to get a good rush of dopamine and get the day going. And then spread out throughout the week, I have 2 separate calls where it's accountability calls, where it's with another man. We go over our non-negotiables in life and just where we're wanting to go. And we cultivated those 7 questions that we go through, again, to hold ourselves accountable. I go to a couple different 12-step meetings a week. And I have one that's definitely like my home group. And then I try to mix it up just to kind of spread out throughout town and just hear what other people are saying. And then I have a Bible study that I started a couple years ago that I conduct every Thursday morning. Solid group of guys. It's funny, about half the people in there are in recovery. I attend church every Sunday, which is something that's very important for me and my family and that we participate in. And then therapy, I'm actually in it twice a week right now, just because there's been a lot that's going on. It doesn't mean that things are bad. It's like you can have a lot of good stress in your life and still trying to navigate that. So I even up that when things are going good in my life. So therapy. And then at the end of the day, there's two things that I do. First is I do questions with my kids, which is really important because it's helping develop a deeper relationship with them. But before we go to bed, there's four questions and we all answer what was good today, what could we improve upon, what are we grateful for, and then what's our goal for tomorrow. That's an amazing tool for people that are wanting to develop a deeper relationship with their kids. Never forget this. This is last week. Delilah opened up to me for about 30 minutes. We're talking about what we can improve upon. She was struggling with one of her friends, and this is an 8-year-old girl. And we talked for 30 minutes. She's asking questions like about, hey, Dad, what did you do when you lost your first friend? And how do you move on? And it was just really awesome. And again, as I'm doing that, not only to develop rapport with them now, but ultimately as they get older, to have a really safe place to be able to come to. And at the end of the day, Ashley and I do an inventory on the things that were good and the things that we need to improve upon. But that way, when we do that at the end of the day, when we put our head to the pillow and we go to sleep, we start tomorrow on a completely fresh day.
I love that. We've always done the what's been the best part of your day, what's been the worst part of your day, and what's your goal for tomorrow. So I love all those pieces. And I think that is something that anyone, even without kids, they could ask themselves that question as they're going through
Yeah.
this. So, Jason, as we wrap up, what would be one piece of advice or a small, realistic step that you would offer to someone that is newly sober into this 2026 year
Yeah.
or is thinking about starting sobriety?
Look, I think it's one of those things that's a lot of great answers that can be put there. But what's really coming to me right now is remember anything worth having is not easy. It's going to take time, energy, and effort to put forth towards that. And an analogy I give to people is something that I think is relatable and you can visualize it. If you go to the gym once a week, you're going to get the results of going once a week. You go to the gym 5 days a week, you're going to get the results of going 5 days a week. So, what you're putting into this is what you're going to get out of it. But also understand that this will be the greatest decision that you ever make for your life, ever, if you just commit to it and make that dedication to changing your life.
I love that. The one of the mottos I live by and that I tell all of my patients is exactly what you just said. Through comfort, there is no growth, and through growth, there is no comfort.
Yeah.
And I think this journey, it isn't comfortable at times, but the growth that takes place is just undeniable.
I will close with this. Recovery, it's given me so much, but I think this from a personal perspective, it's given me purpose, it's given me passion, and it's given me motivation as a person. And that was missing for so long in my life. And then obviously there's so many other things that have come after that, but I needed to get right with myself before I could get right with anything else.
Yeah. Well, thank you so much talking today with all of us.
Right.
I love when we get to chat and hoping that this year continues to be an amazing year for you. And I'll be there sometime this year visiting you in Tennessee and making a lot of new memories with our families.